Lorain County's #1 source for local news, weather, and sports. AM 1320, FM 107.7, Gold Country, and WOBLradio.com.
The following is a paid informational program. The views and opinions expressed are not necessarily those of the staff, management, or advertisers of WOBL Radio.
It's time for the NordCast here on WOBL, and here's your host, Nord Center CEO Don Schiffbauer.
And hello and welcome, everybody, to our first inaugural NordCast. My name is Don Schiffbauer, and when I am not doing these podcasts, I am a proud team member of a great organization here in Lorain County called the Nord Center. And I have the pleasure of being their CEO. And I'm here with my colleagues Dana Santo and Melissa Myers-Fischer, who we'll get to here shortly. But first, I want to tell you a little bit about the Nord Center. For those of you that aren't familiar with our agency, the Nord Center is a nonprofit community behavioral health center. And we've been serving Lorain County. In fact, this year, we are celebrating our 75th year. And for 75 years, we've been providing advocacy in the form of treatment and access to care to Lorain County and surrounding communities. We also have a footprint not only here in Lorain County, serving the 312,000 residents of our community, but also a footprint in Huron County, where we provide counseling and sexual assault services. And the important thing to know about the Nord Center is that regardless of anybody's ability to pay, anybody can seek our services for behavioral health, mental health, substance use disorder treatment. And as I said, this year, we're very excited to be celebrating our 75th year. Our agency has 5 core programs. Those 5 core programs are focused on child and adolescent behavioral health, adult behavioral health. We are the largest provider of residential services in Lorain County for people with mental illness. We also have a sexual assault services and rape crisis, not only for adults, but also for children. And then what we're going to talk a little bit about today is our crisis services. We are the hotline and warm line recipient for approximately 36,000 hotline calls annually from not only Lorain County, but surrounding counties. And we're also going to talk a little bit up at the end of this segment about 988. So we will be diving into these service lines in subsequent podcasts, but in the coming episodes, we'll have an opportunity not only to explore these programs, but to also evaluate and share with you how they make a positive impact on our community. And not only will we be talking about mental health and substance use disorder and how it can be recognized and treated. But you're also going to hear from the Nord Center, but you're also going to hear from our partners that we collaborate with. Tonight's episode, excuse me, we're daylight savings time. I'm thinking it's already dark at 4:30. Today's episode, we are going to focus on behavioral health for the adults. Specifically, we're going to talk about a brand new program that we're offering at the Nord Center. It actually got started in December, and that is Behavioral Health Urgent Care, or as you may hear us refer to it, called BHUC. Now, why behavioral health urgent care? Because you can't go very far without seeing a physical medicine urgent care somewhere in your community. And we know that physical illnesses are just as important as mental illnesses, and we need to make sure that there are opportunities for access to that care. And so on December 6th in 2022, we opened Lorain County's first behavioral health urgent care. And it is the third one in Northeast Ohio, with two of them opening up in Cuyahoga County. Now, before I was the CEO here at the Nord Center, I was a registered nurse in the physical medicine field, and we recognize the importance of behavioral health urgent cares as a important part of that continuum of care. You know, it plays right into people having an alternative to emergency rooms. Maybe you can't get into your doctor's office, and urgent cares give you and your family and your friends an opportunity to get care when you need it. So we're going to do a deeper dive into what is behavioral health urgent care, and I'd like to welcome our first guest, Dana Santo. So Dana, tell us a little bit about yourself and what you do for the Nord Center.
Hi, Don. Thank you so much. I'm excited to be here today. So as Don mentioned, I am the Chief Clinical Officer here at the Nord Center. I've been with the Nord Center for almost 2 years, if you can believe it. We're coming up to almost 2 years. I am a licensed professional clinical counselor in the state of Ohio with a supervisor designation, which is fancy talk, meaning that I can provide supervision to others who are in the field, kind of trying to get their license as well. Prior to coming to Nord, I worked in Cuyahoga County for about 17 years, started as a therapist, and then moved into managing and supervising teams that provided programs and programming to children and families who had experienced trauma. And then I did some work in the homeless space, providing services and housing and helping young adults and families maintain housing out there. So now here at the Nord Center, as the Chief Clinical Officer, I oversee much of the programming that goes on and much of the services that the agency provides. And basically what that means as the Chief Clinical Officer is that I try to make sure that the staff have what they need in order to do the best job that they can do.
Awesome. Well, as you can hear from her experience, you're very well positioned to talk about behavioral health urgent care. So we're just going to get right into it.
Okay.
Let's start with the first question. What is behavioral health urgent care?
Great question, Don. So behavioral health urgent care is another service line that we offer here at the Nord Center that really helps anybody over the age of 18 receive immediate access to care for anything that they may need help with. So they can come into our urgent care and they can see a licensed clinician who can help them talk about their problem or what they need to talk about right in the moment. They can see a nurse practitioner who can help manage some of their immediate medication needs that they may have. They will see one of our care coordinators that will help link them to any resources in the community. So really the urgent care is designed to help somebody who's not able to wait for a regularly scheduled appointment. Maybe they're having an urgent need for mental health, but they're not quite in severe crisis where they need to go to the hospital. And so the urgent care is really designed to fit this niche of clients or people who are in that space of being in between.
Wow. So it sounds as though the urgent care exists for people that are looking to get behavioral health care when they need it, similar to physical medicine urgent cares.
Yes.
And how does the behavioral health urgent care model differ from some of the other services that the Nord Center offers, such as case management or what people may call counseling, seeing their counselor once every week or so? Why go to a behavioral health urgent care versus traditional scheduled services?
Sure. Well, the really cool thing about that behavioral health urgent care is that you can get and access the services that you need in that moment. So what we're really trying to do with this urgent care is capitalize on somebody who's ready to receive services at that moment. We don't want to have people wait 2 weeks, 3 weeks, 6 weeks for an appointment when they need services in this moment. So that's really what we're trying to capture, and that's how it's different than some of the other services we provide at the Nord Center. And like I mentioned, we're really trying to help it be a one-stop shop for the people who may access services there. So they will come in, they'll meet with a clinician to sort of talk through whatever it is that's on their mind. They will meet with the nurse practitioner again, who's going to help with any medication needs they may have. They'll meet with a care coordinator who will help them determine, do they need ongoing services? Should we link them with somewhere in the community? Wherever their choice of community providers, we will help them get there. They do not have to receive services ongoing at the Nord Center, although we would love that. But really, we're trying to capture people who need services when they're ready to get them in that moment.
Wow. And, my next question was, why did the Nord Center decide to embark in a behavioral health urgent care? And I know we have our reasons, but can you tell me a little bit about why the Nord Center decided to take this step and provide this innovative care to our community?
Sure. Well, one of the main reasons, Don, you've already mentioned it, and that is that we're really looking to achieve parity between mental health and physical health spaces. So like you had said earlier, as we have urgent cares for physical needs, we really wanted to capture and provide urgent care for mental health needs. So that's one of the reasons. We really want both kinds of illnesses to be seen in the exact same way. We really also saw the need for this sort of urgency capitalization to be there for clients and residents of the community so that someone can come in and receive services in that moment. And we wanted to be able to provide that for them. And then really, we just felt like there was a gap in the crisis continuum that we want to fill and provide services when we can. So this is just another stop on our continuum of services and really hitting a piece of that crisis continuum that wasn't already present.
Well, that's great information. We're going to be going into a break here, but when we come back from the break, we're going to talk a little bit about what happens when you walk through the door in behavioral health urgent care. So stick around. We'll be right back.
I always had to be so good, no one could ignore me. Carve my path with data and drive. But some people only see who I am on paper. The paper ceiling, the limitations from degree screens to stereotypes that are holding back over 70 million stars. Workers skilled through alternative routes rather than a bachelor's degree. It's time for skills to speak for themselves. Find resources for breaking through barriers at tearthepaperceiling.org. Brought to you by Opportunity at Work and the Ad Council.
This is the story of a very special woman. Just a few knew about her superpowers. In a matter of seconds, she turned herself into a great mathematician. She masqueraded as a regular person at work, but as a superhero at home. Everyone knows her as Gabriella. I still call her Mom.
Your hero needs you now, and AARP is here to help. Find the care guides you need to help, complete with tips and resources at aarp.org/caregiving. Brought to you by AARP and the Ad Council.
Hey, Dad, your prescription will be ready in just a minute. Hey, Dad, your laundry will be ready in just a minute. Dad, your lunch will be ready in just a minute.
Hey, honey, why don't you take a minute? When you help care for a loved one, you give them as much time as you can. But it's just as important to take time for yourself. AARP can help. Find free care guides to support you and your loved one at aarp.org/caregiving. That's aarp.org/caregiving. Brought to you by AARP and the Ad Council.
Ohio Roads and Bridges connect us to things we need and enjoy. It takes a lot of hard work and money to keep roads in good shape. Today, most of that money comes from Ohio's gas tax. As Ohioans drive more fuel-efficient and electric vehicles, people are buying less gas. That's great for our environment, but it means less money for road and bridge maintenance. Ohio is conducting a study to find a new and more sustainable way to fund the maintenance of our roads and bridges. To learn more and to provide input, visit OhioRoadFunding.com.
Sponsored by the Ohio Department of Transportation and aired in cooperation with the Ohio Association of Broadcasters and this station.
All right, we are back for the second segment of our show. But before we get into what can you expect when you walk through the door, I want to take this opportunity for a save the date. Mark your calendars for Sunday, August 13th at 9 a.m. when the Nord Center will be holding its first ever Mind Over Miles 5K race and 1 mile family run. And it'll be hosted at the Lorain County Metro Parks Burr Oak Reservation right in Elyria. Registration for this event will begin in April, but we are actively recruiting sponsors for the event. And you can learn more by visiting the Nord Center's website at nordcenter.org. All right, now I'd like to introduce our next guest, Melissa Myers-Fischer. Melissa, tell our listeners a little bit about yourself and the role that you have here at the Nord Center.
Great, thank you. My name is Melissa Myers-Fischer, and I am the CCBHC Project Director for the Nord Center, and I've been with Nord for a couple years now. CCBHC means Certified Community Behavioral Health Clinic. It's a grant from the federal government, namely SAMHSA, which is the Substance Abuse Mental Health Association or Administration. The Nord is a recipient of that grant, and I've been with the Nord for 2 years, managing approximately $4.2 million for Nord. And this behavioral health urgent care is a sub-project, I like to call it, from my work with the Nord Center as a project director. So myself, I've been with the county actually as a resident and professionally for about 20 years. So I'm excited to be a part of the project and answer some questions that you may have.
We're excited to have you. Thanks for joining us today. And I think also I want to remind our listeners that you heard that this project is a result of federal funding. So not only do we recognize that locally we have a opportunity to weave a tighter knit care continuum, but also at the state and federal levels. Mm-hmm. And we are first of all, we're honored to be able to receive this grant, and we are going to be good stewards of how it's going to be utilized. So, Melissa, let's start right in the bat. So, First of all, we know the hours of operation for the behavioral health urgent care are Monday through Friday, 8 to 4:30. So that people can get an idea of what we're talking about, where's the behavioral health urgent care located?
Well, the behavioral health urgent care is located right in Sheffield Village. So we're on 5425 Detroit Road. So that's right off of Route 92. You get off on Detroit, and really it's such a convenient location. We're co-located within our Sheffield office for the Nord Center. And immediate access, a nice location, parking, and you can see it right there as you go down Detroit, right after Sheets, which a lot of people are familiar with Sheets right there on the corner.
Right in between Sheets and the railroad tracks on the north side of the road. Great.
Very good.
So tell me about who can go and get services at the behavioral health urgent care? Anyone
who is seeking services can get services there. Right now we are serving 18 adults, 18 years of age and older. So if you do come into the behavioral health urgent care, it doesn't matter if you're a resident of Lorain County. It doesn't matter if you have income or not. We are able to provide services to you as you walk in.
Wow. And why might somebody want to go to the behavioral health urgent care? We know people will go to physical medicine urgent cares because of a sore throat, or maybe they're not feeling well, or they might need something for work. Why would people want to come to a behavioral health urgent care, and what have we seen so far?
Yeah, this is such a new model for us that we really had to work through. Why would someone want to come to an urgent care? We know, like you say, Don, like people who would go to a medical urgent care is kind of easy because they're symptomatic, and that's easy to express. But for an urgent care for behavioral health, we often see that people are coming in because of medication issues, or they have questions, or they have merely just ran out of their medication. So we see that. We also have people coming in because they're feeling anxious or depressed. They may be experiencing some changes in sleeping, and they're not sure why. or even eating habits. They could be experiencing some issues with that. So there's kind of different things that someone would walk in for, but generally that's just that feeling of anxiousness, and depression also is some of the presiding reasons.
So we know sometimes when people go either to the doctor's office or to the ER, it can be associated with long wait times. Can you talk a little bit about what happens when they walk through the door, and kind of take us through that cadence of events? Like, who are they going to see first? And then, who are they going to be telling their issue to? And then how long are they going to be there?
Right. So as Dana discussed a little bit about our workflow that we have associated with the behavioral health urgent care, first off, you come into a very warm, welcoming environment of caring staff. I just want to say that. And so the first thing you'll do is, just like any doctor's office, you'll register and check in and do your normal intake stuff. And then you'll get to see the care coordinator that Dana talked about. That person will be doing some just basic screening with you to find out why are you here. And that allows the clinical team to do a little bit of triaging. So help determine how urgent the matter is, and if they need to be seen right away. So it helps us prioritize also. So from there, they'll also see a nurse. We have an LPN that is working out of that office, and you'll get your vitals done and some various screenings. And then from the nurse, you'll also see a licensed clinical social worker. And so that social worker's job is just to do a brief assessment with you. And then you also get to see the nurse practitioner. So you round out through all the clinical team members there, and then you finish up again with the care coordinator that you started with.
One of the other important services that people can go there for is maybe they can't get in to see their prescriber, and maybe they might be running out of their medications. Is going in and getting a prescription to bridge the time till you see your psychiatrist or physician an appropriate visit to the behavioral health urgent care?
Most certainly. We see that quite often for individuals coming in, and they could be Nord clients or not Nord clients. They could be walk-ins off the street. So our nurse practitioner and our clinical team will work with that client to identify what meds they're on. They'll be verifying that with the pharmacy, and then get that new prescription written to support them during that time between prescribers.
Well, Melissa, you did a great job of illustrating for me and for our listeners to talk about what happens when you're going to walk through the door, and how long you're going to be there, and what to expect. So we're going to go into our next break, but when we come back, we're going to talk a little bit about something related to urgent care, but maybe a little bit more urgent.
May is Arthritis Awareness Month, but the Arthritis Foundation fights for people with arthritis all year long with life-changing solutions and medical research, while giving people ways to connect and break down barriers to care. Walk to Cure Arthritis creates community connections, tools, and resources, and supports research for better treatments and a cure. Rock the walk and say yes to conquering arthritis. Register now at walktocurearthritis.org. Sponsored by the Arthritis Foundation, Inc.
Do you want to give back to an individual with disabilities and help change a life? The Guide Dog Foundation and America's Vet Dogs are seeking volunteers to help raise future guide or service dogs. Puppy raisers provide loving homes for puppies until they are old enough to begin formal training. Help raise an adorable pup into a future guide or service dog for a person who is blind, visually impaired, a veteran, or a first responder. Visit puppy.guidedog.org to learn more. That's guidedog.org. Sponsored by the Guide Dog Foundation.
Lake Erie. Dozens of beaches dot the shoreline. And thanks to Adopt a Beach cleanup volunteers, more of these precious spots are healthier, safer, and beautiful. Alliance for the Great Lakes wants you to join this movement with thousands of others that get out each year and make a real difference. About 85% of beach litter is plastic, but with your help, we're cleaning it up. It's fun, easy, and means so much. Go to greatlakes.org/adopt and join us on the beach.
I always had to be so good, no one could ignore me. Carve my path with data and drive. But some people only see who I am on paper. The paper ceiling, the limitations from degree screens to stereotypes that are holding back over 70 million stars. Workers Learn skilled through alternative routes rather than a bachelor's degree. It's time for skills to speak for themselves. Find resources for breaking through barriers at tearthepaperceiling.org. Brought to you by Opportunity at Work and the Ad Council.
All right, welcome back, everybody, for our third segment of the show. But before we get back into behavioral health urgent care and our next topic, did you know that the Nord Center employs over 275 people to carry out its mental health mission in our community? And we've got a terrific team, and we're looking for new team members. There's a wide variety of positions, from counselors to residential aides to people that work in our client access department, which you can all see by visiting our website at nordcenter.org/careers. You can even apply online. Some of our programs are 24/7s, and positions do include a variety of shifts. All right, so Dana and Melissa, I know I want to kind of wrap up our conversation around behavioral health urgent care, and this is actually a great segue to our next topic, but we talked about the appropriate, what's appropriate to go to the urgent care for, but let's talk a little bit about why should you not go to an urgent care and maybe seek services at an emergency room or contacting an emergency number?
I'll start. I would say we've had individuals who have come into the urgent care who we've had to call 911 and get them emergency care. So sometimes you just don't know what you don't know. So as coming in to the right place at the right time is what we're trying to do about creating better access for services at Nord. I would say if you are in life-threatening situation, there's something imminent or serious that is going on, that's when you need to go to an emergency room. And also somebody who's actively suicidal needs to go to an emergency room, or contact our 988, which Don will talk about in a few minutes. But Dana, did you have something to add to that?
No, I would just say the right place at the right time. All of our staff at our urgent care are able to respond to immediate crises as well as those urgent care sort of level situations. So if you come in, we will handle you and get you to where you need to be. But really, what would have somebody go to an emergency room versus coming to the urgent care is exactly what Melissa said. So those more imminent and emergent situations.
Well, that's great to hear that the team is prepared to handle those situations. I was at a medical urgent care the other day, and I said, what happens when somebody comes in? You get people that come in with chest pain and having heart attacks, and she says, absolutely, but we're prepared for those. And it sounds like the behavioral health urgent care is prepared for when those really severe illnesses come in, and then we work with the appropriate emergency response teams to get them to the right level of care that they need.
Absolutely.
So, Melissa Myers-Fisher talked about 988. And 988, if I could sum it up in just one sentence, is the new 911 for mental health and suicide emergencies. And it is a program being rolled out across the country. So, Dana, could you tell us a little bit about 988 and from a high level what it is?
Sure. I mean, I think you said it best with calling 988 the 911 for mental health care. So really, when someone is experiencing a physical health emergency, they call 911. When someone is experiencing a mental health emergency, they can pick up the phone and dial 988 in the exact same way you called 911. And they are trained responders who will answer the phone and talk you through what is going on and then help link you with resources in your community. So I'm jumping ahead a second, but at the Nord Center, we answer 988 hotline calls for actually several communities and several counties within the state of Ohio. Lorain County, Huron, Erie, Wyandotte, Seneca, Sandusky, Ottawa, Richland, Ashland, and Medina. So all of those calls, whenever somebody calls 988, they come into our Nord Center crisis line. And what our crisis clinicians are trained to do is then help link that person with whatever resources are in their community so we can help them access care where they are currently living.
So I think one of the reasons behind 988 is depending on what region you're in, whether it's in the state or in the country, there was the National Suicide Prevention Hotline. There's our local hotline, which is 800-888-6161. But I believe we recognize that there was an opportunity to create one number that is easy to remember.
Yes.
When did 988 go live?
July of 2022. I think it was actually July 16th of 2022. The number went live.
And have we seen an increase in calls as a result of 988 going live?
Yes, definitely. I think we're still statewide and national-wide. We are still trying to roll out marketing and help people gain awareness of this number. But you're right. We want the concept of 988 to be as simple as 911. So when people need help, they are able to access it right in the moment.
And I think the other important aspect of 988, when people call, whether it's coming into the Nord Center call center or coming into a call center down in Franklin County or Hamilton County or Lucas County, they are, even though you may be calling from an area outside of Lorain County, we're going to get you connected to the appropriate resources where you're at. So I know our Director of Crisis Services, Amber, has been doing a really good job of reaching out to the local agencies to ensure that we've got the right resources. So when somebody does call from Seneca, Wyandotte, Ottawa, or Sandusky, that we can get them connected with the appropriate resources. Well, that is great news. And what a really good resource for our community. What I'd like now to do is I'd like to take an opportunity to thank both of our guests, Dana and Melissa, for joining us. And the information that you provide has not only been, refreshing for me, but also very valuable to our listeners. Here at Nord, our mission is to engage people in our community to achieve mental and emotional health through treatment, prevention, and advocacy. I will also say that part of our mission is to increase access to mental health, behavioral health services, and substance use disorder treatment, but also to work to decrease the stigma associated with those. A heart attack and stroke are just the same as having an acute psychiatric episode, depressive, or suicide attempt. And we here at the Nord Center are working with our colleagues in the community to treat these emergencies with the same resources, the same access, and the same urgency as we do other illnesses. And we accomplish this by sharing the importance of mental health and services available not only here at Nord, but as we go on with subsequent podcasts, you're going to hear from other agencies. We look forward to the next time as we explore not only the programs that we have here, but those that help to make a positive impact on the health of our community. We will also highlight the relationship we have with other agencies in our community and how those important collaborations are centered around you. Thank you very much for your time and listening, and we look forward to talking to you again.
The proceeding was a paid informational program. The views and opinions expressed were not necessarily those of the staff, management, or advertisers of WOBL Radio.